Hello, I'm Craig Parker, a data scientist at WIT's Planetary Health Research. Today I'll be presenting the Prescription for a Healthy Planet, a strategic framework for creating a net zero, climate-resilient global health system. The healthcare sector faces a profound paradox. While dedicated to healing, it simultaneously contributes to the environmental crisis threatening human health. Today we'll explore a strategic framework for transforming healthcare into a net zero, climate-resilient system. Tools like the AKDN measurement framework are helping institutions worldwide take their first critical steps toward planetary health. Healthcare is trapped in a vicious cycle. The global healthcare sector's climate footprint equals the fifth largest emitting nation. Anesthetic gases alone account for 63% of surgical emissions. These emissions drive climate impacts, creating health burdens that could cause 15.6 million deaths by 2050, costing the global economy over $15 trillion. This increased health burden drives higher healthcare demand, creating even more emissions. It's a loop we must break. Breaking this cycle requires a dual imperative. First, decarbonization, systematically reducing greenhouse gas emissions across all healthcare operations to achieve net zero. Second, resilience, strengthening infrastructure and service delivery to withstand escalating climate impacts. These aren't separate goals. They're interconnected strategies for ensuring healthcare can continue protecting human health on a healthy planet. Achieving this vision requires action across four interconnected levers. Lever 1, policy and governance, creating frameworks for change. Lever 2, strategic finance, funding the transition. Lever 3, data and digital tools, measuring to manage effectively. This is where the AKDN measurement framework becomes essential. Lever 4, on-the-ground practice, realizing co-benefits. These levers form an integrated system where policy drives investment, finance enables practice, and data guides everything. The Netherlands achieved a 61% reduction in anesthetic emissions in 3 years through a bottom-up evidence-based approach. They engaged anesthetists directly, establishing a protocol, used low-carbon intravenous anesthesia when possible, inhalation when necessary. By integrating this into mandatory quality audits, rather than imposing bans, they achieved rapid nationwide change. This proves transformation is possible when we align clinical excellence with planetary health. At COP30, nations endorsed the Belém Health Action Plan to adapt health systems to climate change. The plan includes climate-informed monitoring, evidence-based interventions, and resilient infrastructure. The reality check: it's voluntary with no binding targets. Only 3 countries have completed required assessments. And critically, it launched with no new funding commitments, leading directly to our financing challenge. $11 billion annual funding is needed for basic health adaptation in low and middle income countries. Compare that to $300 million announced at COP30, a one-time grant. We've been funding consequences after the fact. Strategic co-financing means proactively allocating funds toward risk reduction before disasters strike, building resilience and sustainability through intersectoral strategies. How do we bridge this gap? First, tap into the Green Climate Fund, which has 336 projects, but only 4.9% of adaptation finance reaches health. Second, use innovative models like energy as a service. Private companies install solar systems while donors provide guarantees instead of grants, de-risking projects and ensuring maintenance. The Green Street Africa pilot in Nigeria demonstrates this model, working in partnership with the Federal Ministry of Health. Data is the foundation of smart action, but 5 critical gaps exist. Limited local data for health planning, missing perspectives from marginalized communities, incompatible data systems keeping climate and health information siloed, capacity gaps in data literacy and analytics, and fragmented governance with unclear data sharing mandates. This is precisely the gap that measurement tools like the AKDN framework address. Effective solutions build on existing infrastructure. Kenya integrated flood monitoring into national health systems. Nigeria repurposed cold chain devices for climate data. Malawi created shared forecasts across health, agriculture, and climate sectors. The Climate Impact Checkup calculator provides an accessible starting point, a downloadable spreadsheet helping any facility estimate emissions across direct operations, purchased energy, and value chains. This democratizes measurement for facilities of all sizes. The primary drivers of non-communicable diseases, which cause 88% of deaths in OECD countries, also accelerate climate change. Sedentary lifestyles, unhealthy food systems, and air pollution drive poor health. Car-centric transport, fossil fuels, and unsustainable agriculture drive climate change. These are shared crises demanding shared solutions. Policies targeting public health create powerful climate co-benefits. 2 examples. Sustainable diets. Shifting to plant-rich diets reduces heart disease and agricultural emissions. Belgium and Denmark's guidelines explicitly link nutrition and climate. Active transport. Promoting cycling improves cardiovascular health while reducing transport emissions, which account for 40% of the total. Denmark and the Netherlands invested in cycling infrastructure. Germany and Luxembourg subsidized public transport. These policies don't ask for sacrifice. They recognize human and planetary health are inseparable. These 4 levers form a mutually reinforcing system. Policy creates the mandate, finance enables adoption, data directs investment, practice delivers results. As Simon Steele said, we need sustained, coordinated, well-financed action. Measurement tools like AKDN empower facilities to understand baseline emissions, identify hotspots, prioritize interventions, and track progress. You cannot manage what you cannot measure. Measurement is the essential first step, enabling everything else. 3 strategic imperatives for leaders. First, measure to manage. Empower every facility with tools to understand its climate footprint and enable evidence-based policy. Second, invest for resilience. Embrace strategic co-financing and innovative models to build climate-ready infrastructure. Third, lead with policy. Translate global ambition into action through proven bottom-up models and win-win public health policies. Healthcare can lead in planetary health. The prescription for a healthy planet begins with healthcare healing itself. This presentation was created using Notebook LM for content research, Claude Code for automation, 11 Labs for voice synthesis, and FFmpeg for video production. All tools were used transparently to support evidence-based climate and health education. Thank you for watching. This presentation was created to support discussions on implementing measurement tools like the AKDN framework in healthcare settings. For more information, visit witsphr.org or connect with me on LinkedIn. Together, we can build a healthcare system that heals both people and planet.